All right, future lifesavers and nursing pros, welcome back to the channel. Get your thinking caps on, because it's time for another nursing diagnosis quiz. Are you ready to put your clinical judgment to the test? Let's dive right in. Here's our scenario for today. Picture this. You're assessing a patient named Remedios. She tells you, "I just can't keep up with my household chores anymore, and my knees hurt so much whenever I walk." Based on her statement, which of these nursing diagnoses would be the most appropriate for Remedios? Is it A, self-care deficit related to increasing joint pain? B, activity intolerance related to fatigue and joint pain? C, disturbed body image related to fatigue and joint pain? Or D, ineffective coping related to increased joint pain? Take a moment to think it through. What is the core problem that Remedios is describing? Don't just guess. Analyze her words carefully. What clues is she giving you? Okay, time's up. If you chose option B, activity intolerance related to fatigue and joint pain, you are absolutely correct. Give yourself a huge pat on the back. Now, let's break down why B is the best answer. Remedios' complaints, not being able to do household chores and experiencing knee pain with walking, point directly to a decreased ability to endure physical activity. Household chores are a form of activity, and her pain during ambulation is a classic sign that her body isn't tolerating the physical demands being placed on it. So, why aren't the other options as good? Let's look at A, self-care deficit. This diagnosis is more specific to activities of daily living, or ADLs, like bathing, dressing, feeding, and toileting. Remedios mentioned household chores, which fall under a broader category of general activities, not necessarily fundamental self-care. She didn't say she couldn't dress herself, so activity intolerance is a better fit. What about C, disturbed body image? There's nothing in her statement to suggest she's struggling with her perception of her body. She's focused on function and pain, not on how she looks or feels about her physical self. We can't assume a body image issue without more evidence. And finally, D, ineffective coping. While chronic pain can certainly lead to coping issues, her primary complaint isn't about her emotional or psychological response to the pain. It's about the physical limitation the pain is causing. Her main problem, as stated, is a physical inability to perform tasks. So, to recap, the key was identifying that her problem is a reduced capacity for physical exertion due to pain. That's the textbook definition of activity intolerance. Great job to everyone who got it right. These distinctions are what make a good nurse a great nurse. If you found this helpful and want more quizzes like this, make sure to hit that like button, subscribe to the channel, and ring that notification bell so you never miss a lesson. Thanks for studying with me today, and I'll see you in the next video. Keep learning and stay awesome.